The governor says we have the equipment, but are there enough nurses and doctors to keep Arizona safe? Adam Waltz talked to local doctors about life inside hospitals during Arizona's resurgence of COVID-19.
We hear a lot about beds.
We know to the bed where we are in the state of Arizona.
Available ICU beds for COVID patients at Arizona hospitals, which at last check, nearly a quarter of all ICU beds occupied by COVID patients. But local ICU doctors say it's not a hotel.
We definitely have places to put people who get sick and ventilators to put them on, but we do not have any more of those skilled workers to take care of those patients.
Banner ICUs require 2 nurses per COVID patient, as well as a respiratory therapist. Currently, state hospitals are at capacity for doctors and nurses. Now, last week, Dr. Kara Chris with the Department of Health Services ensuring that there will be enough staff to meet the needs of patients in those beds.
Hospitals have surge plans or emergency preparedness plans,
such as requesting help from the county and state health departments to provide extra staffing.
It's typically not a quick turnaround.
Dr. Dan Kwan views the second wave of COVID cases a little differently.
Actually, an extension of the first wave. You know, we closed everything down, and then we just sort of delayed all the patients that we would have seen, let's say, 2 months ago.
Since June 1st, Arizona has reported more than 16,000 positive cases and 277 deaths due to COVID-19.
I think social distancing and also mask wearing is very important. Are people doing it? Are people heeding that warning? I don't think so.
Dr. O'Hay says precautions taken in March by state officials definitely helped keep the mortality rate down and helped hospitals gear up for this second wave.
This second wave is much more worrisome than the first because we are not starting from a baseline of 0 capacity or minimal capacity.
Adam Waltz, ABC 15 Arizona.